And back home, the Nigeria Center for Disease Control reported 452 new cases of COVID-19 in 14 states overnight, taking the country's total number of cases to 21,371. Of the 452 new cases, Lagos recorded the highest figure with 209, followed by Oyo with 67, Delta 37, Ogun 36, FCT 22, Abia 20, Enugu 16, Bauchi 15, Kaduna 8, Ondo 8, Osun 7, Imo and Benue 3, Borno 1 new case. And a total of 7,338 people have been discharged, while 533 people have died from COVID-19 related complications. And Chief Executive Officer, Center for Integrated Health Programs, Bola Oyelodo, is here to share his views on tackling Nigeria's primary healthcare issues during COVID-19 pandemic. Good to have you join us, Bola Oyelodo. Now, help us understand why at this point, where we have increased cases of coronavirus, the primary healthcare centers are not playing a key role.
Good afternoon, and thank you for having me. So it is important that we begin to look at how the primary healthcare centers will play a key role in the control of the pandemic of COVID-19. It becomes very critical from three main perspectives. Yes, we are in the acute phase. We are also still not testing enough, so we do know clearly that we have a large number of cases, and it is growing steadily, as you can see from the figures you just quoted across the country. It is growing rapidly in the communities. The primary healthcare system is the fulcrum of our healthcare center, of our healthcare system in Nigeria, and it is the first point of contact with the formal health sector. So they are closest. Primary healthcare centers are closest to our communities. So in a community-driven pandemic like ours right now, the PHC, the primary healthcare center, becomes critical from three key perspectives. First of all, they are closest to the communities. And because they're closest to the communities, they will be the first place and the first line of defense and response for keeping communities safe. The second thing is that they can't also be the place, the fact that despite COVID-19, people will still present with fevers, people will still have chronic illnesses like HIV, tuberculosis. There will be pregnant women who will need to come for antenatal care, who will need to come for delivery, who will need to come for postnatal care. They need to come with their babies into the health facilities. And also, the third part is that, yes, we do have a lot of isolation centers springing up all over the country to really address rapidly the large wave that we're seeing. But as COVID-19 begins to really seep into the communities, we find that the primary healthcare centers will still be the rallying points where people will go to as their first line of contact. So it becomes imperative that we begin to look critically at how we can empower the primary healthcare centers, first of all, to be responsive, and then secondly, to use the resources they currently have to really address this pandemic.
Just allow me butt in here, because like you rightly said, the primary healthcare centers are the first line of defense. And according to the Presidential Task Force on COVID-19, we're beginning to see a rise in maternal mortality rate because everyone seems to be focused on, most healthcare centers are focused on coronavirus, and little attention is paid to other diseases and illnesses. So how do we then, what are the challenges basically with these healthcare centers? Why are they not responding like they should?
I think they're not responding as they should because they're not empowered to respond. And I'll say empowered from what perspective? First of all, healthcare centers are not buildings. They're made up of healthcare providers, they're made up of equipment, they're made up of protocols. So we should be asking ourselves at this point in time, are we empowering healthcare workers, these frontline healthcare workers, to really understand how to address COVID-19, how to understand And what protocols do we have in place to make them understand the infection? The second thing is that how can we empower them that despite the fact that we have COVID-19, if we put in the requisite protocols and they need to encourage other people, women especially, vulnerable women, you just talked about maternal mortality. How do we make sure that pregnant women, still irrespective of COVID-19, know that it is okay to come into the health center? The first thing we need to do is that the healthcare providers need to have standard operating procedures and protocols that help them to, despite you walking into the healthcare facility with a fever, they have the first line reaction. They are equipped to understand that fevers are, how to deal with fevers, how to deal with infections coming in so that they are not exposed if it's COVID-19 and they are not sending people back with a fever. If we put the right processes in place, we don't need to turn people back with a fever, and the healthcare workers do not need to get infected.
All right, so data shows that between 2001 and 2014, about 32.7 billion naira was spent to construct about 687 primary healthcare centers in Nigeria. But we also know that just recently there was a cut in the health sector budget by the federal government as a result of COVID-19. What more do you think can be done in terms of funding, not just for the primary healthcare centers, but for the health sector?
Well, definitely one of the things that COVID-19 has shown everyone across the world, not just Nigeria, is that we have not paid enough attention to the healthcare sector. Countries that have paid enough attention to the healthcare sector are actually reaping the rewards of their investments. But all is not lost. We can go back to the drawing board. We have these centers already in existence. The question is, can we make them stronger in the sense that we invest in them to be able to deal and address with basic infections? Primary healthcare centers are supposed to be able to address basic issues, making sure that babies are immunized, making sure that women have the right environment.
I wish we could give you. I wish we had enough time for you to properly respond to that question, but I'm afraid we do have to leave it there. Chief Executive Officer, Center for Integrated Health Programs, Bola Oyelodu. Many thanks for sharing your perspective with TVC News.